episode number 49 of the Wholesome Fertility Podcast. Welcome to the Wholesome Fertility Podcast. I'm Michelle, a fertility acupuncturist here to provide you with resources on how to create a wholesome approach to your fertility journey. My guest today is Dr. Lindsay Martens. Dr. Lindsay Martens has been in practice as a naturopathic doctor since 2006. She adores working with women to help them understand their bodies, their unique rhythms, and reconnect to their own body wisdom. Through her journey to motherhood, she found her passion and purpose in helping other women and couples in their fertility journeys. Dr. Lindsay Martens takes a whole being approach to her care, looking at all aspects of health and lifestyle with her patients to help them find a deeper experience of health and vitality. So welcome to the podcast, Lindsay.
Thank you.
So can you share your journey on becoming a naturopathic doctor and specializing in fertility?
Yeah. So the whole journey to becoming a naturopathic doctor started when I was pretty young. I've got two sisters that are quite a bit older than me, and one of them was experiencing some health concerns, and she decided to go to the naturopath in our area. And very quickly after starting her work with her, she was like, "This is something Lindsay would love. Lindsay needs to go see this naturopath." So I forget exactly what age I was, but probably around the ages of 12 or 13, pretty young, and at that time in the world, naturopathic medicine was pretty few and far between naturopaths in the world. And my experience with that naturopath was great. I loved it. I loved everything she did. And so I just knew then that that's kind of what I wanted to do. So from then on, in all of my schooling and stuff, I just did what I needed to do to get to naturopathic school. And then the journey to specializing in fertility started when I was in school in Toronto. And again, my sisters, a big influence on me, obviously, they were struggling to get pregnant themselves. And I was in school, so I knew some, but not a lot. And I knew there were things like other options available than just what was being presented with Western medicine or typical infertility clinics at the time. And then when I got out of school and I got married, I knew that my own body, my menstrual cycle wasn't super regular. And I knew that if we wanted to have kids, I would need to do some kind of work, some care around my own system and hormonal health. So I went to see another naturopath at that time and got some treatment, got some care that way, and changed my menstrual cycle, changed my hormonal health patterns, and got pregnant. For me, the ability to get pregnant was, in the grand scheme of things, relatively easy. But I had 2 miscarriages before I had my first child. And so there was still a lot of pieces of pregnancy and the journey and the difficulty of it and watching the things my sisters went through and all of that I just became really, kind of found my passion and purpose in helping women know that there are more support, more options, more care available to them than, just going to an infertility clinic setting. Yeah.
Yeah, I love that because there are so many things that people can do, and it doesn't have to be so complicated or so invasive.
Totally. Yes. Yeah.
And so for those who may not know what naturopathic medicine is, can you go into explain it?
Sure. So it's so, the more I practice, the longer I've been in practice, the more broad almost naturopathic medicine becomes for me, which is interesting. So we are primary care doctors that look at the body just, I think, a little bit differently, in the sense of, we always take in that it's a whole system. You are an integrated being. You're not kind of cut up into pieces of, especially with women I'm working with, I always say to them, we're not going to just look at uterus and ovaries. Like, we're looking at your whole being, your whole system, and how those things are interplaying and connected and affecting each other. And then naturopaths use pieces of nature, I guess you would say, or so natural remedies, herbs, supplements, things that our body recognizes, and then use that to support the system, support the body to do its normal function. So I'm rarely using anything that would, really push or force the body to do something. I'm always giving it the nourishment or the building blocks, or some of the balancing that it needs to find its rhythm again, if you will. Yeah.
Yeah, totally. It's very similar to Chinese medicine.
Absolutely.
I've had actually a naturopath on it's the philosophy of it and the theory behind it of the body healing itself.
Exactly. Yeah. And actually in Canada, I think this is different in the States, but in Canada, as naturopaths, we are trained in traditional Chinese medicine as well. So
oh, wow.
yeah,
cool.
So acupuncture and Chinese herbals are a big part of my practice here. I know for naturopaths that are trained in the States, I'm not sure exactly how it works, but I know that acupuncture and traditional Chinese medicine is sort of an extra piece of schooling they could do. But in Canada, it's integrated into our system. Yeah.
Oh, that's amazing.
Yeah. So very much,
that's great.
Very much the same philosophies there.
Awesome. So you learn acupuncture and you learn all of the herbs and the formulas.
Yeah. I mean, I think we learn all of them. It's a lot. Yeah. If I vaguely remember back to the schooling, it seemed like a lot of stuff.
Yeah, for sure. I mean, I can't imagine like adding to what I was trained to do, also naturopathic medicine.
I know. I think back to what we were doing in school sometimes.
No wonder you were out of balance.
That's the thing, right? It's, we would jokingly say when we were in school, like, it's the most unnaturopathic program ever, because it's just so much and so many hours, and yeah, very thorough. It was good. It's good.
Yeah, it's good now. Of course, it's great because you really understand it thoroughly. Yeah. It's interesting because you're gonna know what I'm talking about. One of my first teachers in the first semester was like, "Your spleen." Yes. He was telling you, he goes, "Your spleens are gonna get shot." Yeah. He goes, "Just expect it." Okay, so for the listeners, the spleen is not like Western medicine where it's your immune system. Yeah. It basically, in Chinese medicine, is your digestive system. And it's very much connected to thinking. Mm-hmm. So if you overthink or overstudy, it can really impact the spleen. Yeah. And of course, you're really overthinking and overstudying in school. So.
I know. I think there's moments where like my spleen is still in recovery. Even this many years out.
Whose spleen isn't, if you think about it, I mean, that's like the one thing everybody, going back to the digestive system and going back to what you said, which I find so intriguing and so true, is that it really has nothing to do with the ovaries and the uterus. I mean, it's not just the we're talking about the digestive system is like at the core of everything. And I feel like there's so much assault on it constantly just by normal living.
Totally.
Anywhere you go.
Yeah. Yeah. And it's a big, I mean, a lot of women that come to see me, they're looking for something different. They're looking for someone to take a look at them as a very complete person. But it's also a real education to teach them that, their digestive system, their liver is a major part of what's happening for them from a hormone or fertility standpoint, right? So,
yeah, absolutely. And so you deal a lot with nutrition as well.
Yeah. So nutrition for me in my practice is, so how I typically approach a treatment plan, I guess, is I do use supplements or herbs or whatever I think is going to make the most effect at the beginning. And we work on the lifestyle pieces as we go. So nutrition, stress management, sleep hygiene, body movement, all of those kind of come into play as we're treating the sort of the bigger picture that we're seeing. So nutrition is a part of it. All lifestyle pieces are a part of it for sure.
Yeah, definitely. And it's interesting to me too, is that there's so many food allergies out these days. I mean, I just feel like it's more than it ever was.
It is. And it's another piece of education for sure when I'm working with patients around, I have a lot of patients, a lot of people come in with diagnosis of PCOS or endometriosis, and those two are affected by nutrition greatly. And with the PCOS label and how it's being treated with, like we use metformin here often, people are starting to understand the insulin pieces to that, or but even then it's not always the answer for a lot of women. But that one, they can at least understand how their nutrition might be playing a role. But endometriosis, helping women see the connection between digestive system, immune system function, and this endometrial type flare up is definitely something they need to learn. And then once they do, and really commit to whatever nutrition plan we think is going to help them the most, it can make massive changes in their body for sure.
Yeah, because a lot of times there's excess estrogen and the body not being able to cleanse it. And also inflammation, that's a huge one.
Yeah.
And so, there's definitely foods. If you have any kind of food allergy, you're going to get some kind of inflammatory response.
Yeah. Yeah.
Yeah, it's definitely a multifaceted thing.
Yes.
All across the board and all across everybody. Not everybody with PCOS is going to have the same response to everything.
That's right. So. Yeah. Yeah. And that's very much, again, I'm sure you do this as well, but trying to really, as you work with people from a traditional Chinese medicine standpoint or a naturopathic view, whatever you kind of want to say, you like kind of label that as, you will get, 5 women in front of you that have had the diagnosis or label of PCOS put on them, and they are all different. It's all different patterns. It's all different causes, and treatment is different for them. And that's not something they're used to experiencing, right?
Yeah, absolutely. And so when you're diagnosing somebody, what are the different things that you're looking at? And do you also use Chinese medicine patterns along with it?
Yes. Yeah. So when a woman comes in to see me, most often she has already been to a fertility clinic, or even sometimes just her family doctor, and blood work and ultrasound has already been done, perhaps even some laparoscopic surgery, that type of thing. So from an investigative standpoint around lab work and that kind of thing, I don't have to do a lot usually. Usually a lot has already been done. And so then it's a lot of talking. It's a lot of chatting about their experience and their history and their life up until that point. Because, I don't think we always find all of the reasons or all of the inputs that are causing them to sort of be in this place. Everything that's kind of been in their life up till now has also led them to that place. So if we can start to really connect some pieces of their journey so we can understand why they're, in the experience they're in at the moment, it can help a lot to focus treatment on things, right? So so most of my work at the beginning is just trying to understand them and their bodies as much as possible. So that is, we talk about digestion and immune system and sleep and energy and mood and emotions and stress and all of those kinds of things. I do use TCM pattern as part of my diagnosis. So tongue and pulse is in there. And then, in Ontario, I have the ability to order lab work if needed. So sometimes there's some investigative work that way too.
And do you ever consider, I guess in Chinese medicine, I know they consider emotion a lot. and see that, because that's like a huge, the
Yeah.
mindset and the emotions and trauma.
Yeah. Yeah. Yes.
Yeah.
And it's something that doesn't, I mean, even so, let's say someone hasn't had anything major happen to them in their life up until, this experience. Sometimes the process of going through infertility treatment or even the investigation of it becomes very traumatic and stressful. And so I try to make sure that they know in my office that is talked about, and I hold space for all of that emotion. They're usually not getting, in the fertility clinics, everything's kind of quick and they're getting moved through, and
Hmm.
there's not a lot of space for them to process what's happening to them or the emotions that are coming up with it. And it's
Hmm.
important to process emotions and to have them move
Yeah.
through our body instead of getting stuck in our body. So it's a big part of the work I do for sure. And I also, a big part of my work that I'm integrating more and more is helping women to get reconnected back into their body. I found a lot of women through infertility treatments kind of get a bit dissociated or a bit disconnected from their body. It's like all this stuff is being done to them and they're, on
Yeah.
medications or whatever. And a lot of them start to feel like they're losing touch with their body and with their intuition and with knowing themselves, And so a
Yeah.
lot of my work or part of it is helping them to stay deeply rooted and connected in their own body, because I really think the body has wisdom to share with us. And when we're connected to it, we can express it, right? But when a woman comes into my
Yeah.
office that is disconnected from her body, she doesn't know anymore, right? You'll ask questions or ask about symptoms and stuff. And it's like, I don't know. I'm not paying
Yeah.
attention or whatever, which is, so we don't pay attention to everything, obviously. But definitely when there's a disconnection there, it becomes much more prominent that we start to kind of lose something. And even in going through fertility treatment, if you can be grounded and processing your emotions and processing the stress of it, it's going to help the whole journey for sure.
I completely relate to what you're saying. And it's true. I have so many different patients coming in, and some of them won't notice. But over time, as I say, well, just pay attention to the subtleties of your menstrual cycle, how you feel before, after.
Yeah.
And over time, those are things that can actually get really cultivated.
Yeah.
And it's not something that you're born with or that you necessarily have to have a gift for. It's nothing like that. It's something that you can really cultivate.
Absolutely.
It's like the subtle energy with your body and this relationship with your body. And it's amazing because when you do that, whatever you're putting your attention to, you almost bring life into it.
Yeah.
And it's kind of a strange thing, but as like a naturopath or as a TCM practitioner,
Yeah.
you start to you watch people every day. You're practicing every day, and you're noticing things every day, and you start to see patterns.
Yeah.
And it's really an interesting thing. It's not something that like is necessarily scientifically studied. Well,
No.
maybe some.
Yeah.
Maybe some, they're
Yes.
scratching the
Yes.
surface here and there. They
That's
are.
right.
But it's something that you start to pick up when you see people or with your own practice. And it is interesting how when you start to pay attention to your body, it's almost like when you're paying attention to a child, they light up. It
Absolutely.
responds to you.
It does.
There's like this intelligence. Yeah, it's
Yes.
incredible.
Yeah. And I also have seen a lot of women where they were experiencing let's say normal menstrual cycles, and they're not getting pregnant. So they go and do some investigative work with fertility clinics or with their doctor. And all of a sudden their cycles aren't normal anymore or as regular or, whatever. And it's almost like just the stress of the experience has now shifted their cycles to become a little bit more irregular. And then that perpetuates the cycle. And it's the same, right? When we when we can start to shift that and start to bring trust back into our body, it starts to regulate itself back into its quote unquote normal. Yeah.
Right. And it feels so much better. It just
Yes.
feels so much better to operate from that place. And especially when you're going through something as difficult and challenging as fertility challenges. I mean, it's like
Yes.
one of the hardest things people can go through. And
Yes.
especially then is when you really need that
Yes.
grounding and that connect. That's and I've heard so many people say they go to doctors and they're giving a diagnosis and it doesn't quite feel right.
Yes.
And sometimes they feel almost I don't know, this weird obligation or intimidation to just go with what they're being told because these people are knowledgeable, they're experts. And then some of them say, you know what, it just didn't sit right with me. My body didn't feel right.
Yes.
Somehow their bodies told them, dig a little deeper, and they go to a different doctor and the doctor picks up on something that the first doctor didn't. It's
Yes.
really interesting.
Yes.
It's like your body is your little wisdom, your guide.
It really is. Yes. Yeah.
Yeah. Very interesting. I'm very fascinated by the whole mind-body connection.
Yes. Yeah. Well, it's powerful.
It is really
It's a really
intriguing.
powerful one. Yeah.
Yeah, for sure. So, as far as when you see a patient and you obviously spend a lot of time with them and talk to them and figure out what's going on. And then what are the steps that you usually take in order to help them?
Yeah.
With a different.
Yes. So my initial visit with somebody is pretty long. I think it's 2 hours that we spend together. And even then I find sometimes it's not long enough, which is amazing, right?
Yeah. You could really spend like all day with someone. Yes.
You really could, to try and really understand and connect the pieces together. I've been in practice for a while, so I feel like my ability to pick up on pieces that are connecting has gotten better and better the more that I've been in practice. And so usually at the end of that visit, I have a pretty good sense of what's happening for them. And so I try to explain that as best I can. Sometimes it takes people a little bit of like sitting with the information I'm giving them to fully integrate what that means. Because especially when you're using, Chinese medicine framework, they have to kind of wrap their brain around, the spleen's not the spleen or whatever it is, right? And so I try to like make sure it's, understandable and everything. And then usually there's some supplementation, whether that's herbal or nutrient-based or a combination, that we get started on right away. I like to make sure that the body is nourished. So often I'm seeing some sort of deficiency pattern somewhere along the way in the body. And so I try to make sure the body is really well nourished with supplementation and herbals. And then we almost always, I'm doing acupuncture with them. I do use acupuncture or as a treatment. I use it a little bit differently than probably most TCM practitioners, in the sense of I see my patients maybe once a month, maybe twice a month, but I don't see them more frequently than that. So I don't do weekly acupuncture or something like that. If I feel that would be a big benefit for them, we tend to try and find them an acupuncturist for them to see as well as me. And then I tend to see them on a monthly basis. There's lots of communication in between those visits, especially if there's some lifestyle factors we're working on at the same time. So they have a lot of support to start making shifts and changes. And I try to time my appointments around their cycle somehow. So if I'm trying to support ovulation more or their follicular phase more or whatever, we'll try and time our appointments appropriately. And then, every appointment we're sort of like revisiting, going back over like what was the last menstrual cycle like, what was the signs and symptoms they experienced, what's happening in their body, what's happening with their sleep and their energy, all of that kind of thing. And my follow-up appointments, they're about an hour long as well. So everything is a lot of time spent in a great way. Yeah.
Yeah, definitely. And it needs it, it
Yeah.
really, it's about really changing and, their journey. And
Yeah.
so the herbs that you use, are they, American herbs, or I know that you do Chinese herbs
Yeah.
as
So,
well. You
yes,
do both?
I do both. Yep. I try to be really, really specific about what I'm using supplementation wise. I
Mm-hmm.
don't ever want my patients to be on 10 different supplements or something like that. So
Mm-hmm.
if I'm going, I tend to go either like more of a Western herbal route or a Chinese medicine route for the
Mm-hmm.
herbals. I don't often interplay the two together. But
Okay.
sometimes I do. Yeah. So it's kind of a combination of all of it, but
Yeah. But it's great. You have a lot of tools. That's
I have a
wonderful.
lot of tools. Yeah. Sometimes too
Yeah,
many. Sometimes it's hard to narrow in what we're doing, but yeah.
it is. Yeah. Sometimes you can have a lot. You're like, wait.
Yeah.
But
Did
I
I
think
pick
like
the
over
right
time,
thing?
yeah, but over time, I think, one of the best things is really spending time with a patient. You almost start to feel intuitive and called to do certain things
Absolutely.
when you give that time.
Yes. Yeah. And then it becomes, if that's something, because that will happen to me in a visit where I'll just be like, this is what they need. And sometimes I can't even fully explain why it is. So then I kind of have to go back and be like, okay, what triggered me to say that? Because I want it to be understandable and for them to know
Yeah.
what we're doing and why. But definitely there'll be moments where I get I guess some people would call it an intuitive hit of sorts, where it's just like,
Hmm.
this is the support they need. Now let's work
Yeah.
backwards and
And you
figure
just
out
kind
why.
of know.
Yeah.
Awesome. I love it. So, what inspiring stories can you share?
Yeah, I was thinking about this a little bit, and it's tough to totally narrow in some of them. So I've had a lot of women. The endometriosis piece comes up a lot for me here, and that's the one where I've seen a lot of shifts and changes when people start to make the nutritional changes with them. So
Hmm.
I've had a couple women, especially in the last little bit, where they were, put on Lupron to suppress their cycle. And then the plan was to do that and then go into an IVF cycle, which they did. It was unfortunately unsuccessful for them. And so then they wanted to kind of take a break. So they were seeing me throughout that process. And then during the time of the break, it was like, okay, so let's focus in on some of the nutrition pieces. Like, let's focus in on the self-care and what you can do for yourself. And then, 2 or 3 cycles into that, they get pregnant, and they've gotten pregnant. And it's interesting because it's such a clear, like, as soon as we can calm the inflammation down around endometriosis, it
Hmm.
it makes a massive difference in pregnancies for those types of women. And then I always love the women that, this one has a special place in my heart because it was part of my experience as well, that were on birth control pill and have come off it and their bodies are crazy feeling,
Yeah.
right?
Yeah.
And
I've been there.
yeah,
Yeah.
totally. And helping those women to get regular ovulation, a regular cycle, and for them to be able to feel the magic of watching their body do the cycle, as it kind of should have, if you would.
Hmm.
I love that so much. I love them saying, hey, I saw like my cervical mucus, I think I ovulated. And then about 2 weeks
Oh,
later,
that's
they
great.
start bleeding. And you're like, yes, that's how it's
Yeah.
supposed to work.
Hmm. That's right. You're back. You're back.
Yeah, yeah. And those types of things happen with really simple changes around helping the body either, detox through excess hormones or just give it the nourishment it needs to relearn how to ovulate, because it has been shut down on birth control for a while. Yeah.
Yeah, and also, especially with endometriosis or even fibroids, can we just kind of discuss the xenoestrogens in the environment, because that's
Yeah.
a huge factor.
Yeah. I almost all my patients at some point in their work with me will have some sort of liver support put in
Hmm.
because it
Yeah.
just is so difficult in our current world to not come in contact with the things that throw your body off. So, the xenoestrogens that are around from all sorts of, like almost every material, right, that you come in contact with, or chemical, or
receipts. I mean, it's everywhere.
It's everywhere. And so the need to help the body's detoxification process is definitely needed. I rarely will do a like kind of the detox protocols that a lot of people would think of. So like, a really strict or fasted type nutrition, and then laxative based supplements, right? Like that kind of thing doesn't happen for me. But helping to support the liver's ability to process through all of the junk is a big piece of helping to get a lot of women's hormones back on track. And there's just not a lot to kind of get around that. Like you can clean up your environment as much as possible for sure. And there's still going to be things you're coming in contact with along the way that can really throw it off.
Yes. Yeah. I think that you bring up such a good point, because it's really about teaching your body to adapt and giving it, you can't avoid it completely, but you can teach it to adapt, or show, support it with herbs and lifestyle. And but it's something we cannot, unfortunately, completely avoid.
No, I know, I wish we could, but no, we can't. We really can't. So
yeah, but it's definitely something I wanted to bring up, because that's a huge thing. What happens is we have such a perfect homeostasis, our body's programmed a certain way, and it doesn't know how to recognize fake hormones or something that mimics hormones.
That's right.
That little shift or change or perception really throws off the delicate balance that we have.
Yeah. And that comes into play a lot in my work, where a lot of people want, I don't know if you get this with your patients, but a lot of people want lab work. They want numbers. They want to know if their estrogen is too high or too low or whatever. And the reality is that if we're going to do lab work like that, it's always going to come within normal limits, because our reference range for these hormones is massive and not specific. So there's more in-depth lab work that can be done for sure. But the conversation always comes around to, it's not so much the levels you have, although that can play a role. It's the communication that's happening between these hormones. So either between your own natural hormones or any synthetic or hormone mimicking compound that's coming in is going to throw that communication off. And then your body's going to do something different with the different message that it's getting. Right. So it's a big,
exactly. So it may look normal, but it's actually perceiving something, because it's always going to try to create homeostasis and balance. So it may look normal, but what it's doing inside, or why it's making it look normal, might be taking away from something else, because it's thinking that you're getting excess hormones.
Right. Yeah.
Yeah. So it's definitely, it's a tricky thing, but I agree. I mean, the liver is incredibly important for, it's really everything.
It really is. Yeah. I was
for sure. There are poor livers, man.
I know. They do a lot of work.
Yeah, they really
do a lot of work. Yeah.
So great. And then if there's any tips that you have for the listeners.
I know. I was thinking about this earlier today as well. And the biggest one I hope is useful is to just practice a daily practice of tuning into your body, because as you're on this journey and the various practitioners and doctors you come in contact with, at the end, it's going to be, how does that resonate with your own body wisdom? And that's how you're going to, know you're on the right path, with the right care, with the right practitioners, with the right treatment plans. And so if something isn't feeling right, if something doesn't sound right to you, keep digging, keep looking, get more information that might look like more investigation, but just really, really keep tuned into your own body, because you can kind of get on this train of treatment, especially when you're in a fertility clinic setting, that feels like you can't get off of it sometimes. And yet your body might be screaming at you to kind of get off of it for a second, to get some of the body wisdom back. Right. So a real daily practice of just connecting with your own body can help along the way to just be sure that you're getting the right practitioners, the right treatment for what is happening in your own system.
That's great advice. I mean, that's something that we were just talking about before. Your body's constantly giving you messages, and it's constantly speaking.
Yes.
And it's just a matter of just kind of getting quiet and really tuning in.
Yes. Yeah. And anybody outside, so like me, for example, I'm there to help you interpret the messages you're getting, because maybe it's about knowledge you don't have, right? Like, you know, maybe you're an accountant and you don't know anything about hormones or whatever it is.
Right.
And yet it's your body's information that is leading us, right? Yeah. So keeping that connection, I think, is a big piece of the journey.
Definitely. And you actually consult from afar, right?
Yeah. So depending on location and things like that, there's some consultations we can do from a distance for sure. So people can reach out, send me an email, send me a message, and get connected. Yeah.
And how do people find you?
So right now I have two websites. One is naturopathicfertility.com. The other is drlindsaymartens.com. And either one of those will lead to the same place if you're, sending a message or sending an email. And then I spend most of my time in social media land on Instagram, and that is Lindsay MND.
We're all there.
Yeah, that's where we like to hang out sometimes. So those are the various places.
Wait, repeat that. I'm sorry. I said something when you were giving the handle, but I will be putting this on.
Oh yeah. It's Lindsay MND.
Okay, awesome. So I will be putting all this information on the episode notes if anybody wants to go back and take a look. And this was great. I thank you so much for coming on.
Oh, thank you for having me.
Yeah, I love the whole theory of naturopathic medicine. I know that you combined it with TCM, but I generally in areas that they don't combine it, there is such a synergy between the two.
There really is. Yes.
Yeah, and the way they look at the body as a whole, and it really comes down to, at the core, treating the whole person, which I love. I do think that that's a very progressive way to approach it.
Yes.
Well, thank you so much for coming on.
Yeah, thank you.
So that concludes today's episode. You can find all the links mentioned on the episode notes. If you're enjoying these episodes, please take a moment to leave a review. Reviews are everything to podcasters. You can find me on my website at www.thewholesomelotus.com. And please be on the lookout for my online course and program. This course has emerged from everything that I've been using for the fertility program I now offer at my office. I wanted to consolidate all of my suggestions and coaching and put it into a form that anyone can purchase and use. It was important for me to encompass key fertility health factors as well as guide you in implementing changes in your routine that are shown to boost fertility while being realistic and user-friendly. I will be offering this course with and without coaching. If you're interested and want updates as well as a free ebook on my top 10 fertility boosting habits, you can visit my fertility page on www.thewholesomelotus.com, where you can find the subscription form. I thank you so much for listening in and hope you have a beautiful day.